Correctional Services of Canada is responsible for the imprisonment and rehabilitation of criminal offenders sentenced to 2 years or more. Inmates on average suffer from disease before imprisonment, and that presents a risk to themselves, correction staff, and others. The cost of health care for offenders is higher than in the community at large. This is due to the high prevalence among the offender population of mental health problems, substance abuse, infectious diseases, and chronic diseases. This video will focus on the health of the offender population in custody within Correctional Services of Canada, most importantly, the population groups at risk: Aboriginal, women, and juvenile offenders. Women and Aboriginal offenders are at an increased risk of poor health because they experience greater barriers to key social determinants of health. Women often report 4 common health conditions: back pain, hepatitis C, asthma, and head injury. As of 2013, Aboriginal offenders represent over 20% of the total federal offender population. Aboriginal women offenders experience higher rates of HIV, hepatitis C, and sexually transmitted infections compared to the general population in Canada. The CSC should continue the implementation and monitoring of applications of the Public Health Strategy Framework to ensure CSC provides the offenders with essential health care and reasonable access to non-essential mental health care services. The CSC should establish and chair an international electronic working group for youth offenders for research and exchange of qualitative research data on youth imprisonment. Policymakers must be aware of the quantitative data regarding youth imprisonment or the prevalence of mental disorders. In addition, they must have access to holistic qualitative data to fully understand what it means to be imprisoned.